You've talked about, or we've talked about, how the idea is to stay at home and stay in isolation, but still stay connected. How important that is, particularly when it comes to seniors who are feeling lonely and isolated. And Dr. Humaira Saeed is with me this morning, who has come up with a fantastic idea to help those seniors. She's a palliative care physician within the William Osler Health System, and she's in Toronto this morning. Dr. Saeed, welcome to our program.
Thank you for having me.
I will let you tell the whole story. What exactly are you doing?
So I'm a palliative care physician at William Osler Health System, and I work in multiple different environments. I work in hospital, hospices, nursing homes, retirement homes to provide support for patients. And there's a common thread across all these environments, and that is that visitors are limited. So patients aren't interacting with their families the way that they used to. And as a frontline provider, I've witnessed a sense of loneliness and suffering that I've never seen before in many patients. Families are such an important part of a patient's care. They provide psychosocial support, they provide personal care, and they advocate for our patients, right? They advocate for their loved ones to have the best care possible. I really found that this gap needs to be bridged. And so I found that technology and mobile devices have been one way that we can try to bridge that gap between patients and their loved ones.
So technology, specifically you're looking for people to contribute pieces of technology, right, to make those connections possible?
Exactly. So there's a huge potential to allow patients to see their loved ones through tablets, iPads, smartphones, and I've been collecting these devices just from family and friends, and it's taking off from there.
And then you give them to the patients, and they're able to speak to loved ones. And in those you've seen, when they have that connection, Dr. Saeed, what kind of a difference has it made?
So at Osler, where I'm working right now, they are setting up a virtual visitors program on a larger scale. And I'm really excited to be able to have patients communicate with their loved ones that way. Right now, the facility does have widely accessible Wi-Fi, so any patients that do have a mobile device, they're able to connect with their family. I think it provides a lot of relief for family members sometimes, just to be able to see their loved one, see what's going on with them. Otherwise, we are their eyes and ears. We're telling them what their loved one looks like, whether or not they're family members in pain, short of breath, are they able to talk, are they eating? That's all information that we have to provide them if they can't see it for themselves.
Wonderful and essential for the families, a little bit of reassurance in these very uncertain times. Can I just ask you a question? Really, one of the most heartbreaking aspects of all of this is to have these people dying in care homes or in hospitals because of the virus and the illness, unable to have their families there at those last moments. And here you are, as you said, you're seeing things that you've never seen before for seniors. What is your day-to-day like now during this pandemic?
So my day-to-day has been quite variable. So sometimes sometimes I'm with patients eye to eye, and sometimes I'm actually doing teleconferences with them. It just varies day to day. With patients who are very much at the end of their life, depending on the institutional policy, some patients' families might be able to come in and hold their hands, and based on the policy of whatever facility you're at, that might not be possible. So we are using a lot of, just reassurance for patients, letting them know that they aren't alone, giving them the best care that we can, making sure that they know that there's someone there that cares for them, and updating families as much as possible. Nurses and care aides have been fantastic in taking on this extra role to update family members as much as possible.
I just think, your role is just so vital right now, given the constraints on so many family members, and I'm wondering how you view it, to be so close to the people who have no one else around them potentially at that point at the end of their lives.
Well, I certainly feel that our job is very important, and I feel like I'm making a difference for our patients. Family members and patients are so appreciative of the work that we do. We're just trying our best, and we're going to do whatever we can. This is the long haul in terms of the pandemic. We don't know when things are going to settle down, but we are really hopeful that we're going to be able to give patients the best care possible.
Dr. Saeed, it's a pleasure to meet you, and to make sure that people know about this. We'll put all the information where people can reach out. In fact, if they have equipment that they want to donate to the cause, keep that connection and help you in your very valiant and critical work at the end stage of so many of these patients' lives. Thanks very much, Dr. Saeed, for joining us this morning.
Absolutely. Thank you.
A pleasure.